Hi, I'm Dr. Moira Bradfield Strydom, a naturopath at Intimate Ecology, and I want to talk to you about testing your vaginal microbiome. So, at Intimate Ecology, we often test people's vaginal microbiomes using technology that samples the entire microbiome, so giving you information on all bacteria and all fungal species. And we do that because we want to see what an entire ecosystem is actually doing at a time point when you have symptoms. You may have already had culturing done, you may have done some selective PCR, another technique that can identify bacteria, but often using a more comprehensive method gives us a better big picture, but also allows us to hone in on the details and structure treatment that is very relevant as well. So your vaginal microbiome isn't just good and bad bacteria. It's more about this concept of how they interact with each other, what is peaking at times when you might have symptoms, and what might you be missing if we're thinking about beneficial bacteria and the modulation of that environment. And then within the clinical setting, we push that out into an understanding of your hormones, what your immune system might be doing, what your overall nervous system health is like. Do you have metabolic or predisposing factors? What's your digestive health like? All of these things are very relevant for us to be able to come up with a very specialized treatment protocol for you that is about you and your experiences. So we're not using guesswork to be able to implement treatment. So if we're using comprehensive testing, depending upon where you are in the world, we might recommend slightly different testing companies to work through, but we want one that is comprehensive, which means all bacteria, all fungi, because we get this better snapshot of what is going on. It's really important because it lets precision overtake frustration for you. It lets us identify the things we need to know about. So if you are testing, when is the best time to test? So testing and timing does actually matter. It's actually quite useful to test when you have symptoms, and those are the symptoms that are the ones that are bothering you the most. But there are some caveats around that in terms of ideal test conditions. We want you to avoid testing when you have bleeding or you're on your period, if you've had sex in the last 24 to 48 hours, if you've used an insertion of a vaginal product, whether that's hormonal or moisturizing, or if you've used probiotics, particularly probiotics within the last 1 to 2 weeks, vaginally inserted, or if you're on antibiotics or recent antibiotics, depending upon the circumstances, there might be a recommendation to pause interventions. We want to capture your microbiome at the point when it's in trouble, at the point when you have those symptoms. And there are always different things where we can't pause antibiotics, or if you're on long-term antibiotics and you want symptom assessment, that's completely okay. Or if we want to look at the vaginal microbiome as a supported by probiotics, that's also okay. But those are individual things that you need to discuss with your clinician because the context really matters when we go to interpret those results for you. So how do you take a sample? Well, the process is pretty simple. Most test companies will send you a swab, and the swab, you can see, is sterile. You don't touch it with your hands. There's usually a little red line on it or a line, which you can hold down to if you need to. There are instructions in these swabs in terms of how you gently spread the labia on your vulva, insert the swab into the vaginal canal, rotate it around usually for 30 to 60 seconds, take it back out, put it into the swab container and seal it. We also would encourage you to read the postage instructions so that you know how you're going to activate your kit and take the swab to the post office and send it back. So we want you to understand that because, again, depending on which country it's going back to, we use a US-based company a lot for comprehensive testing for Australian clients. There are some new nuances to postage and tariffs that you need to be aware of, and we have additional handouts so we can help our Australian clients send that back to that company. You need to label it in a certain way so it doesn't get caught up in biosecurity. Tracking is really good so that you know where it is. If things do go wrong, however, there's always support on hand from the testing company itself, and we're happy to troubleshoot with you if we can. Then we wait for results. So results usually come in from about 2 weeks once the testing company has received the swab in. And then once we have those results, we would connect with you to have a consultation, take you through the results, make sure that you're not concerned about anything. If we need further testing based on the results, we would advise you about that. And then we can jump into very specific interventions. And those interventions might be herbal and nutritional, which is where our practice primarily focuses on holistic interventions. They might be complementary and integrative, meaning that we're using standard pharmaceuticals alongside restoration and modulation approaches for the microbiome. But the key thing is you have to interpret that properly so you know which approach compare together, which ones are the best combinations so you get the best outcomes. So if you've been stuck in a cycle of recurring symptoms, vaginal microbiome testing might be for you. And the more comprehensive the test, actually, the better the understanding that we have and how we can customize treatment for you. Gives us more data, more direction, more success, essentially. So less guessing, more precision for you. If you need more information on vaginal microbiome testing, please connect to the Intimate Ecology Clinic, book an initial consultation where we can take you through the individuals and recommend a test that's appropriate for you and your presentation. And you can find more details about our clinic at www.intimateecology.com.au. Thank you, everybody.